You know, one of the common problems that you see in children, even in the adult population, is this skin condition known as eczema. We see that about up to 20% of the U.S. population is susceptible to the development of eczema, and there's all kinds of different treatment modalities available to really help keep it under control, but it can be a very aggravating condition, as anyone with eczema knows. Recently we saw studies showing that one of the significant ways to control eczema and to treat it efficiently is to use a topical form of vitamin B12. A lot of people don't know about this. A lot of doctors haven't really discovered it yet. But studies show that using a topical form of vitamin B12 right on the lesions has been very successful in adults, in that it helps to suppress the release of nitric oxide in the skin, which tones down excessive blood flow to certain areas, so things are less red, and the cell division rate now slows down. So the question then was, could that be a useful treatment in infants and in children and young teenagers? So in April of 2009, in the Journal of Alternative and Complementary Medicine, Dr. Janikowski was able to show that the same thing was true for children. So they did a study using children who had eczema and giving them topical application of vitamin B12. So in this study they took 21 subjects who were between 6 months old and 18 years old. So these were, you know, infants and toddlers and children and older children and even later adults. And they took half the group and gave them topical vitamin B12, and the other half of the group got just a placebo product. And what they saw was that in the group given the vitamin B12 topically, when they looked at their skin after 2 weeks and after 4 weeks of daily application, there was a significant reduction in the eczema, the extent of the eczema. It was actually regressing and the skin was improving to a very dramatic degree, in fact. So topical application of vitamin B12 is something that's new. A lot of eczema sufferers don't know about it. We know that it works in adults. We now know that it's safe and effective to use even in children who have eczema, and that's a fairly significant percentage of them, actually. Now, there are other things that help to address eczema that you can do internally. And that is to take some vitamin E and a multiple vitamin and some essential fatty acids and so on. But the doses have to be reduced, of course, if you're using this on an infant or a child, you have to try to lower those doses. But to get a very good picture of the comprehensive management plan for eczema in general, I would suggest strongly that you take my nutrition lifestyle anti-aging assessment that's online and it's free. And when it asks you the question, do you have eczema, you simply say yes. It'll give you the whole comprehensive program that you should be following. It's all laid out right there, and you'll see a link at the bottom of this page so you can get access to it immediately if you want. So if you're an eczema sufferer, you ought to do that. What's really important is that most recently we've seen that the topical application of vitamin B12 has been very effective at controlling this condition, something that I want you to know about for yourself if you're an adult and for any child that you know who may be suffering from this problem.